Expert explains what is the reason of too much hair fall. Hair fall following the COVID-19 infection has been a concern for a number of people. And rightly so, it's not called your crowning glory for nothing. However, temporary hair loss is quite normal after having a fever or any illness. But when hair loss is excessive, one is bound to wonder what is the reason of too much hair fall. Read this expert guide to know more about hair fall and what you can do to address this issue. To begin with, it's important to understand that hair grows in cycles. One hair growth cycle consists of 3 phases: anagen, catagen, and telogen. In the first phase, hair strands grow actively, and this phase may last years. During the second phase, hair stops growing, separating from the follicle or root, the structure that holds the hair strand in place. This phase lasts around 10 days. During the third phase, the follicles rest for a couple of months before the hair falls out. The cycle repeats with the anagen phase, with new strands of hair growing in the same follicles. Note that this is a natural cycle, and it's normal to lose 50 to 100 hair strands per day. But if you're losing more hair every day, it's a sign that this cycle has been disrupted, or that hair follicles have been damaged. What is the reason of too much hair fall? Dermatologist Dr. Meeta Desai says that excess hair fall can be due to scarring or non-scarring. On being asked what is the reason of too much hair fall, she said the most common causes were androgenetic alopecia or pattern baldness, both in males and females, diffuse alopecia due to postpartum hair loss, or telogen effluvium, which can be caused by stress, anemia, crash dieting, or diseases like typhoid, tuberculosis, COVID-19, or malignancy, drug-induced hair loss, anti-cancer drugs, anticoagulants, hypothyroid and antithyroid drugs, alopecia areata, neonatal alopecia, ionizing radiation, collagen vascular disease, endocrine disease, parathyroid polycystic ovarian syndrome, using chemicals like SLS, aging. Excess hair loss usually occurs when hair falls out more quickly than it is regenerated, as explained earlier. Watch out for symptoms like overall hair thinning, hair falling out in patches, or a receding hairline. This infographic will help you understand better. Tip: when addressing what is the reason of too much hair fall, make note of any stressor and symptoms of hair loss that you observe and convey the same to your doctor so they can advise the right treatment plan. Hair care practices. What is the reason of too much hair fall? Sometimes, you might notice excess hair fall even after treating your tresses to the best hair care products. The reason for this can be following a routine or practices that actually damage your hair then prove beneficial. Dr. Desai advises the following for what is the reason of too much hair fall. Have a routine in place for your hair. Avoid going for long without shampooing. Regular hair washing and scalp cleansing is a must to clean bacteria and fungus, dead skin cells. Condition your hair regularly to retain moisture and make it easy to manage. Use serums and hair masks as needed. When oiling your hair, use oil sparingly. Too much oil will require excess shampoo to wash off, leading to over-drying of hair. Avoid rubbing hair, especially when wet. Allow hair to air dry. If you must blow dry your hair, blow dry it cold. Avoid heat as it can damage hair. Opt for gentle hair styling to avoid damage to the hair. Follow a healthy lifestyle, eat healthy meals, relax, meditate, and exercise regularly. Tip: take care of your hair by using the right products and gentle styling and hair care practices. Facts: what is the reason of too much hair fall? Can you share some home remedies for too much hair fall? A. Home remedies can prove to be useful for hair loss. Dr. Desai suggests the following. Apply onion oil directly to the scalp or use diluted in your regular hair oil. Use fermented rice water to rinse your hair. Use aloe vera with yogurt or apple cider vinegar and coconut oil to nourish your hair. Apply a hair mask made of egg mixed with honey, lemon, aloe vera, and olive oil. Coconut oil mixed with milk can improve hair health, as can fish oil, omega fatty acids, licorice root, green tea, and fenugreek. Amla, Indian gooseberry, can be used in various ways for healthy hair and scalp. Massage your hair with a mix of rosemary and jojoba oils. Always massage your scalp gently. Q. What else can I do for healthy hair? A. Apart from using home remedies for hair fall, keep these pointers in mind. Get your hair trimmed regularly. Avoid hot showers. Don't comb wet hair. Avoid or limit smoking and drinking alcohol. Eat healthy and stay hydrated. Control stress. Q. What treatment? are available for too much hair fall? A. Dr. Desai says, applications like minoxidil, peptides, caffeine, etc. can help control hair fall. One can consider taking nutrition supplements like biotin, zinc, amino acids, iron, and vitamins B12 and D, hormones like OCP, finasteride, spironolactone, disease-specific treatments, and procedures like laser hair comb, derma roller, platelet-rich plasma therapy are other options. While most of these treatments are safe, Dr. Desai advises consulting a dermatologist who can check your family history and health condition and suggest the best treatment.